Hello, everyone. Welcome again to the Borderline Personality Disorder Family and Consumer Education webinar series. My name is Chris Palmer. I'm a psychiatrist here at McLean Hospital, and on behalf of McLean Hospital, it's my pleasure to welcome you today. Before we get started with today's webinar, I just want to go through the logistics quickly. On your screen, you'll see kind of 4 different boxes. On the lower right-hand side is a Q&A box, and we do want this webinar to be as interactive as possible. So if you do have questions or challenges that you're struggling with and want feedback on those, please type those in during the webinar. You can type them in at any point. So if you've come to the webinar today with specific issues or questions, go ahead and type them in now and we'll put them in queue. And then in the lower left-hand corner of your screen, you'll see links to a lot of different sites. That first one is our website, which has all of our recorded webinars available. And the next several ones include links to important resources, including the National Education Alliance for Borderline Personality Disorder, and you're going to hear a little bit more about that today. And then finally, these webinars are brought to you for free through a philanthropic gift from a family who's been affected by borderline personality disorder. We would love to be able to continue these indefinitely, but we'll likely need additional support to keep them going. So if you're in a position to be able to support these webinars, we welcome you to click on the link, support these webinars, and any gift, large or small, would be very much appreciated. And so today we're going to be speaking about family members' perspective on borderline personality disorder and helping a loved one. We are joined today by Doreen for her own families and her own confidentiality. I'm not going to provide you her full name, but Doreen has a family member with borderline personality disorder. She has been involved in the Family Connections groups and has helped to co-lead several groups over the years, and so has a really broad experience with a lot of different family members' struggles and perspectives, and she's going to bring that to us today. So please join me in welcoming Doreen.
Hi, thanks for joining me today. I'm a mother of someone who has BPD. However, I'm going to speak about all types of family members today. I requested not to list my name so I can keep my loved one's information and situation as private as much as possible. In fact, I will use the term they instead of he or she. Let me first apologize for reading. I wanted to be a little more animated and spontaneous, but because I tend to talk in circles and wanted to cover as much as I can, I have to read my presentation to try and stay on track and to keep myself on time. This is a talk for family members. If you have BPD, the things I talk about may be triggering. There are no secrets here. I just want to be upfront with you. If you have BPD, I know you have your own challenges. It's just that this talk is geared more towards our challenges as family members, and they may be tough for you to hear. I was asked to do this webinar for a couple of reasons. The first is that after some of the professionals have spoken in other webinars, many family members write in and ask questions about dealing with life at home. As smart and as helpful as professionals can be, only another family member truly knows the possible grief, disappointment, frustration, loneliness, and sadness, etc., of living and loving someone with BPD. I've been there and I've done that. The second reason I was asked is that I'm also a leader of Family Connections classes and have been for about 4 years, or actually over 4 years now. Many of the professionals have suggested to you listeners to take the Family Connections course, and many of you wanted more information about it. I will talk more in depth about it later, and I will also talk about other helpful resources. The title of this webinar is The Family Member's Perspective on BPD and Improving Relationships. I asked to use the generic term family member in the title versus mother. Since BPD presents in so many ways, and every family is different, my situation and loved one may be very different from yours, and you may not be able to relate to me or them. Instead, I'd like to compile my talk today from a variety of family members' perspectives. I've had the pleasure of being involved with so many. In fact, you may hear me say we and us instead of I when I give suggestions. You see, to learn how to help my loved one and myself, I participated in several support groups, I've attended BPD conferences, and in the past 4 years, I've taught Family Connections 9 times. I've also been involved with almost 150 other family members that include parents, siblings, romantic partners and spouses, and adult children of someone with BPD. The BPD loved ones of those family members range in age, gender, and sexual orientation. The loved one's issue may range from the mild end of BPD spectrum to severe dysfunction. The loved ones may not have shown symptoms of BPD until after some type of trauma, or they may have exhibited issues since they were young. I've seen a lot in the support groups and in Family Connections, and hopefully I can convey things that you can relate to. As you can see, I'm going to use the term loved one when I refer to family members with BPD. That term can be hard sometimes for some of you. Many family members often don't feel a lot of love towards the person with BPD or vice versa. But I find it easy to use the term loved one since when I say family member, especially today, I'm going to be talking about us. The other half of the title today is improving relationships. That is something I've had great success with personally, and I've seen so many other improved relationships in the families that I've worked with. I'll try to pass on some helpful hints today. I'm sure my talk won't be life-changing for you, at least right away. It took a long time for me to grasp the suggestions I'll make, but I hope you can come away with at least one or two things that make a difference for you. Let me really emphasize, though, I'm not a professional. I can't answer medication questions, treatment questions, or give you advice that a professional would be better suited for. I can only try to relay some suggestions from personal experience and tell you about the things that have helped others, too. I'll also have Dawn, the coordinator for these webinars, send out a follow-up email with the links to all the websites and books, and I think you'll find they can put the links here also in this lecture. Or in this format that I refer to during my talk, so you can access them quickly without rewatching the webinar. Before I can get into this challenging information, I want to tell you that I love my family member. Yes, we have been through hell with BPD, but my loved one, and hopefully yours, is more than just BPD. I had to be reminded of this myself, actually by my loved one. Our loved ones can be challenging, but they can also be creative, funny, smart, adventurous, etc. Sometimes we need to focus a little more on what they can be or do versus all the things they may not. I'm not going to tell you my sad but yet hopeful story, again to keep things private. I am a parent, but because of my relationships with others in my own immediate and extended family, as well as friends and fellow Family Connections participants, I've had a front seat to what it is like to also be a sibling, a romantic partner, and a child of someone with BPD. What I have seen is parents, even though it is challenging to do so, are somewhat used to sacrificing for their child. Although difficult, it can be easier for them to make some of the changes that I'll talk about that are needed to improve the relationship. Parents can certainly be burned out by the time they get to Family Connections, but I have yet to see anyone that didn't benefit from the skills that we teach. Siblings of people with BPD have it tough because they are not supposed to get unequal love and attention from their parents, yet that's what can happen. There can be a lot of resentment towards a sibling with BPD. In many sibling cases, like with siblings of people with other types of handicaps, there can also be feelings of guilt when they see their loved ones suffer. Some siblings feel the need to be happier or even perfect, or at least be holding it together, to ease the burden on the parents and the family, yet the siblings may be struggling too. Romantic partners and spouses, it's rough. You are supposed to have a partner to share in life's burdens, but you usually don't have a partner in the true sense of the word. You often have to give much more than you receive, and in some cases, your partner's issues add to your life's burdens. And children of people with BPD, you have a reverse relationship with your parent. You often become the caretaker, and you are often the one to make the sacrifices and take the high road. I feel for all of you out there. We are in a club that no one wants to belong to. There's a lot of burnout with caring for someone with any chronic illness, but in our case, no one brings us casseroles or cleans our house for us, and offers for help go unanswered, because again, no one gets it. How can they even begin to help? How can you even let them in? So my first suggestion to help improve your relationship with your loved one, and improve your life generally for that matter, is allow yourself to grieve. No parent looks at a baby and says, I hope someday you grow up and have BPD. Siblings and adult children being born into a difficult family was not your choice. And if you fell in love with someone with BPD or turned out to have BPD after you started the relationship, I'm guessing you didn't know it could be so complicated. It's okay to wish things were different. I'm pretty sure our loved ones wish things were different. But if we don't grieve, we may remain stuck in misery. But suffering and grieving with our loved ones instead of apart from them may take some of the blame that you have against each other. We experienced family members have found it to be very validating when we tell our loved ones, "I'm so sorry that this happened to you and our family. It sucks." When we allow ourselves to grieve, it can help us to move on. The rest of my talk will focus on changes in us as family members because I have to give you a heads up. The way to start to improve our relationships with our loved ones with BPD is not about getting them help or changing them. It's really about making changes within ourselves. You see, we can be just as guilty as our loved ones when it comes to the bad relationships. We know our loved ones often blame us for all of their problems, but we are often blaming them too for putting our life into dysfunction. The biggest challenge for family members is that we have no control over our loved one with BPD. We can't make them accept the diagnosis, get the proper help, or help at all sometimes. We can't stop them from making decisions that often end in disastrous ways, nor change their future for the better. It's really true of anyone that when you think about it, we can't make family and friends stop drinking or smoking, lose weight, or get out of bad relationships. Many of us are even guilty of needing to do these things ourselves. People have to see the situations as a problem and want to make changes themselves. Everyone has to do their own hard work and follow through. People with BPD are no different. So all we as family members can do is improve our half of the relationship. What we can do it as a minimum is try not to make it worse for our loved ones. But I do admit what we have found through family connections is that by making our own positive changes, we often do improve our loved ones' lives too. One of the first suggestions for family members is to make an attitude change. Sometimes just by seeing our challenges differently, we can gain a better perspective. Have you ever been caught in traffic and been so mad about it? Happened to me last night. But then when maybe a good song came on the radio and you calmed down, maybe you called a friend or a coworker, and actually the extra time wasn't so bad after all. A positive attitude, or at least a neutral one, can make a huge difference. I personally have helped my own attitude about my loved one by viewing BPD and actually all mental illnesses as a medical illness. I started to think, why is the brain treated any differently than the other parts of the body when there's a problem? I think of mental illness as an invisible disease, a kind of misfiring of the brain. We don't get upset when someone with diabetes doesn't act normally when their blood sugar's low. So why do we get upset when people with BPD are having a tough time and can't do something easily? The challenge for us is that sometimes our family members look okay or might have accomplished something really big recently, and we may be quick to judge. Well, you did that. Why can't you do this? You look fine. Can't you just try? Or rather, my previous favorite, you aren't trying hard enough. But if our family members had a missing limb, huge swollen joints, a visible severe rash, or any other obvious way to see their handicap, would we be so hard on them when they say they're having a tough time? I've even come up with my own term, emotional seizure. That's what I call it when my family member acts out in anger, sadness, or even retreats. I like to think of it as the brain is in overload and goes haywire. But instead of throwing the body into convulsions, the emotions go into convulsions. By thinking of BPD in a medical way, it helps me and others I've relayed this perspective to not take these outbursts so personally. Instead of feeling, why are they doing this to us? Maybe we can think, well, they must be really dysregulated to be acting this way. We can try to think about what else must be going on for them to be lashing out or maybe not even responding. Because most of us have found that the outbursts or retreats are not usually about what our loved ones are saying. It's about they don't communicate very well when these things happen. For example, if they are mad that someone ate their favorite food, or maybe you changed the channel or turned the heat down or said something the wrong way, maybe what they say they're upset about was just the final straw in a day full of anxiety, or they couldn't sleep the night before, they had a problem at work, or their commute was complicated. What we have found is that there's often a 1-2 punch. People with BPD have a hard time in what most of us consider normal life. So they aren't going from 0 to 60 as we often complain. They're usually surviving at about 45. It may be that they missed a lunch break, then dealt with a tough coworker, but it was tripping over the shoe in the hallway that set them off. But all they complain about is the shoes. We don't know about the first 2 jabs before the punch. My point is, by not taking things so personally, it can help us to keep from getting so emotional or angry ourselves. Staying calm helps us to respond to our family members in a compassionate way versus an angry or hurtful way. By not taking things so personally and being able to stay calm, it can help us to say, wow, you sound really upset. What's up? or what can I do to help, versus what the hell is your problem and stop treating me and acting this way. I learned a lot of my coping skills from taking Family Connections, which I'll talk about in a few minutes. But I also had done some other important things beforehand that helped me to be more accepting of the information that I eventually learned in Family Connections. When my family member, my loved one, was first diagnosed with BPD, I was a bit shocked. Like many of yours, they had been diagnosed with other diagnoses in the past. How was this different, I asked. So I researched the internet and read books, and I learned a lot. So my next suggestion is get educated. I learned BPD was very different from depression, anxiety, mood disorder, and bipolar that so many of our family members got misdiagnosed with. I learned that unlike mood disorders, BPD was really linked to interpersonal situations. Depression can hit no matter what is going on in life. Anxiety can pop up out of nowhere. Bipolar illnesses, ups and downs, can come in lengthy cycles. But people with BPD can change their moods hourly. Our loved ones can call in the morning and be in a good mood because something good happened. 2 hours later, they can feel so despondent they talk about suicide. And then they may get an invitation from her friend and pull it together and go to the movies with them. It's draining and exhausting to ride the roller coaster with them. I want to admit that many of our loved ones do have some of these other mood disorders in addition to BPD. And if they do, they may need extra help and treatment for these other diagnoses. But after perusing many websites, I found the one for National Education Alliance for Borderline Personality Disorder. It can be found at NEABPD.org. I found it very helpful and hopeful, a breath of fresh air after reading so much negativity about BPD. The website had so many videos and other resources to educate me. I suggest you take a look and try to find the time to read and watch. On the website, there was a link to John Gunderson and Cynthia Berkowitz's family guidelines. I printed the guidelines off, and it became my Bible. I read them, I reread them, I shared them with my husband. I even sent the link to family members and close friends who knew about my loved one. These guidelines helped me to start to lower my expectations, understand the need to stay calm, and really listen to my loved one instead of trying to tell them not to feel the way that they do. There's so much other guidance in them that not only helped us, but they helped to those closest to my family to understand about BPD too. I remember my husband's parents saying, I had no idea. We will adjust our expectations too. I had someone close to me with severe anxiety tell me once, I never feel so alone as in a room of people who love me. I was so shocked because my own loved one had such a hard time at family gatherings too. I asked this person with anxiety more about it. She said she can go easily to casual social outings because people are just happy to see her and they don't ask a lot of questions. She said when she is with those that she is close to, however, they have such high expectations and ask so many personal questions. It's overwhelming for her. And if she's having a hard time, how can she answer, no, I'm not enjoying work. I can barely get through the day. She'd rather just avoid the family gatherings altogether. It was eye-opening for me. I tried to convey all of this to my extended family so they would just welcome my loved one and just let them sit, or only engage with them if they initiated or if it was superficial. I wanted them to be supportive without pushing, and I hope this information may help some of you out there too. In our Family Connections classes, we like to use the airline's instruction, put your own oxygen mask on first, which means that if you are not taking care of yourself, you will not be able to be in a good place to deal with your loved one. In the early years when my loved one started the spiral downward, I felt so overwhelmed. I wasn't sleeping, I wasn't eating, and I became really anxious myself. Often when I would just want to vent, I would complain or cry to my husband, but instead of calming me down, my venting would often escalate him, which didn't help our child either. I realized I needed a neutral party to talk to. I sought out a therapist for myself, and it was extremely helpful. Often my therapist would put me in my place, which actually I didn't like very much. Absolutely, she would listen and support me when needed, but she would also point out when I was crossing my loved one's boundaries or expecting too much of them. My therapist helped me regain my composure, stay calm, and get a balance back in my life. So many other family members have also found personal therapy to be an invaluable source of support and guidance. However, I have to tell you that there are good therapists and, like any other profession, bad ones. Even if someone is recommended, you may not even have good chemistry with them. I suggest before making an appointment, call the office and ask questions. See if they have experience with BPD, or at least personality or even mood disorders. Ask if you can speak directly with the therapist to get a feel for them. Even if they don't have experience with BPD, at a minimum, get someone you can you're comfortable with. You're going to need to open up, and you need a safe place. So obviously my next suggestion is get help and support. Many people tell us that they cannot afford a therapist or don't have access to one. Maybe you live in a remote area or you can't get out of work, etc. In these cases, at least try to find a confidant. Talk to another family member, a friend, someone in your church, even a coworker. We are also afraid of the stigma of mental illness to tell others about our situation. But most of us have found that when we started to be open about our situations, others actually told about their struggles or experience with their own family member. When I finally opened up to others, a longtime friend admitted to me that her husband battled depression. Another told me her daughter cuts. Another had a son with drug addiction. I had no idea about their struggles, nor they about mine. It was amazing and so helpful to share and support each other. At a minimum, be selfish. If you can afford it, go for a massage, go to a movie, go to a sporting event. If you can't afford something more, just simply take a long walk, a hot bath, sitting on your front steps and watch the clouds go by. Take a drive to clear your head. Find any way to do something for yourself, or at least help yourself calm down. Sometimes in a tough conversation with my family, I've been known to say, I just need a break to go to the bathroom. And all I might really want to do is just run my hands under cold water and take a few deep breaths. Sometimes just in that pause and the change in our physical space, it gave us both a change in our perspective. Our loved ones often feel abandoned when we do something for ourselves, even taking a break to go to the bathroom. But if we present it in a positive way, you can say, I know you really need me right now, but I just need to take a quick break. I'll be in a better frame of mind to listen and support and try to help you if I can do that. The next thing after getting a therapist was to join a support group. You may not have access to one, especially for family members of someone with BPD. My first one was just for family members with people with all sorts of diagnoses. Even if there's none for mental illness in your area, you could try an Al-Anon group or whatever support or religious group is in your area. They all have similar principles, such as this is beyond your control, you can only try to improve and take care of yourself, etc. There are also web-based forums, blogs, and Facebook pages which you can find and which you can join and find support. Talking with others who are struggling can take away some of the loneliness we feel. You don't feel judged like you might feel when you're talking about your loved one to a friend or even some of your own extended family member. I know mine, so a lot of mine were pretty judgmental. The next thing I did was to read some books. They weren't necessarily always for mental health challenges, but I found the material helpful anyway. They often gave me new perspectives. I read some parenting books, even though they were geared towards younger children. I read ones about Buddhism and mindfulness, and of course, many about BPD. Some I barely got through or didn't even finish at all, and some were easier to digest and I read them quickly. Each of them gave me something to ponder and maybe even plant a seed in my brain that would grow and might help later. Some books, though, really made me change my behavior. They helped me take a deep breath, lose some of my negative judgments, be more compassionate, and be able to validate, and also help me to find some win-win solutions. Again, I'll have Dawn make these links into this format and also send it out in the email to some of the books that were helpful to me and others. But with a quick search on Amazon, I'm sure you'll find additional ones that are specifically about BPD. Order the books if you can afford to do so, or check to see if your library has them. Many libraries will even order them, even if they don't have them. Many family members in support groups, and definitely in family connections, even lend their copies to others. Don't be afraid to ask. My husband and I also took a DBT class. DBT is short for Dialectical Behavioral Therapy, which has been so helpful to so many with BPD. But I admit my husband and I weren't helped by the class at first. The challenge was that we were required to take it because our teenager was taking it. It seemed like we were just there to understand what the teens were learning, not to actually employ the techniques ourselves. Instead of helping, I started to use the information against my family member, not on purpose, but that's basically what happened. I would say, have you tried the blah blah skill? Why aren't you writing in your diary card? And the worst, you aren't trying hard enough. That last one was especially horrible because that's actually one of the core principles of DBT, is to accept that everyone is doing the best that they can at that moment. That took a long time for me and many others that I work with to really fully absorb. But I was exposed to DBT time and time again as my loved one tried it again and again. I grew to understand and use the skills as they did. But my suggestion is to research DBT and its skills. There are books and even web-based classes if you don't have something in your area. The principles and skills can be invaluable for yourself and to support your loved one if they are learning it. At a minimum, my next suggestion is to try and accept that we are all doing the best that we can. When your family member with BPD is engaging in tough behavior, and especially self-harm, some of us family members will respond with disappointment, shame, anger, and emotional outbursts ourselves. But some of the more articulate loved ones with BPD have told us, me cutting myself is me not hurting someone else. Me stealing is me filling an emptiness inside. Me sleeping all the time is me not killing myself. I heard a professional support group leader once say, if you felt that awful, why wouldn't you lie, steal, cut yourself, sleep around, do drugs, etc.? That really stuck with me. If you can find a place of acceptance, the next suggestion is to be compassionate. This doesn't mean that you should find these behaviors acceptable and tolerate them. It just means that you might be able to try and look past the verbal tirades and challenging behaviors to the emotions and pain behind them instead. If you can start to feel compassion for your loved one, the next suggestion is to practice forgiveness of yourself and your loved one. I have basically said to my child, you know, I want to tell you I'm sorry. I didn't understand you were born so sensitive. I wish I had handled things differently. I did the best that I could at the time, but I'm going to try to continue to do better. I've had to say it a few times before they believe me, but these conversations were life-changing for us. I truly have come to accept that they were doing the best that they could when things were hell. They were just trying to survive on their own personal battlefield. I have forgiven them, and I have to tell you the feeling is freeing. There have been others that have been through much worse situations with their loved one than my family has experienced, but letting go of the past has helped them to move on too. BPD is hell. It is hell for us family members, but I also can't imagine what it is like inside our loved one's head 24 hours a day. It must be so hard to be so sensitive, on edge all the time, so insecure that they have to question everything and everyone around them, and to be so fragile that the slightest mishap can send them into a downward spiral. What many of us family members have learned is that you can't rationalize with an irrational person. When a loved one is having an emotional seizure, we encourage family members not to try to reason with our loved one in their heightened state. Their reasoning part of the brain is just shut down. You being logical isn't going to work. The emotional part of their brain is in full control. We also can get so caught up in trying to be right and point out their faults that we lose our effectiveness. They just won't listen. Before I learned better skills, I used to ask all sorts of questions when my loved one was upset. What happened? What's wrong? Why are you so upset? And then, of course, offer all sorts of great advice. Maybe if you just do this or that, you'll feel better. You just need to relax. Just talk to me. This is what you need to do. And my personal previous favorite, it's not a big deal. You're just overreacting. I can't say enough about losing judgment and being present in the moment. It's not on this list of suggestions since I just added it last night. And I know be present can often be overused in today's society. But with us family members, being in the moment means to not let past tough experiences with your loved one and anxiety about what may happen in the future cloud the situation you're in. Anxiety can really make us screw up the tough moments. Believe me, I'm the queen of making things worse by letting my own past emotions and my future fears, or fears of the future really, invade the situation. If we can reach a compassionate place, when our loved ones are having an emotional seizure, we can react instead by maybe just listening, saying things like, that sounds like it was really tough for you, versus, here we go again. What I just said, that sounds like it was really tough for you, is an example of a validating statement. I wasn't agreeing, I wasn't trying to cheer them up or make it better. It's too hard to teach you to master validation here in this hour-long presentation, and it has been covered in other webinars. But validation is the next step after gaining compassion. Validation isn't agreeing with someone, it's just being able to convey to the other person that you understand how they might be feeling. A suggestion we give about validation is to try and react to your loved one as if you would to a coworker instead, someone that is not a close friend, someone you would be more polite to than another family member, because let's admit, we're not always the most polite to our family members. You probably wouldn't tell your coworker after they complain about a bad weekend, you better get your act together. You might say, geez, that's too bad. It sounds like things didn't go as you had hoped. Validation is not trying to make someone feel better either. In fact, cheerleading, as we call it, can be really invalidating. Examples are, I know you can do it. I believe in you. Don't worry, it'll get better. And another one from my past. Don't be so sad. We love you so much. Even though these are all said with the best of intentions, cheerleading can actually make the situation worse. Hasn't your loved one replied back, "You're not listening to me," or "You don't get it"? Our loved ones just want to be heard, not preached to. How many of you are fixers? Welcome to the club. In the not-so-distant past, professionals actually used to blame the family for causing BPD. Invalidating environment. Don't you just love that term? We don't mean to be invalidating. We do have the best intentions. We do admit, though, that many family members often step in, offer solutions, and just take over the problem. We are often blamed by our loved one for not understanding, not listening, and taking over, even though sometimes they asked us to step in. And taking over is so much easier than to let your loved one suffer. It really happens slowly. It's so hard because we become exhausted trying to support and encourage and listen that we finally give in, and then our lovely calm settles in. We may think, wow, that was so much easier. So the next time we don't have the energy to listen in battle, we just jump to the fixing. So my next experience suggestion is to pull back and find a balance. This will probably take some professional guidance or at least some help from a curriculum-based education group like Family Connections. I can tell you that continuing to step in and take over is not helping our loved ones gain the skill of emotional control, and it certainly won't foster independent skills. Our stepping in may make us feel better, but it's actually hurting them. I do admit when we often need to step in when safety is a concern, and there will be times when we need to help our loved ones. So if they are really struggling. So it's not 100% of the time suggestion. Everyone needs help now and then. What we want to do is find a balance between help and support versus enabling. Again, you may need professional advice or at least an educational course to give you the skills you need to make this change. So let me finally speak about the educational courses. You will find information about them on both of their websites. Again, the links will be here. NAMI, the National Alliance on Mental Illness, has a course called Family to Family. It's geared more towards a broader group of mental illnesses. I have not taken it personally, but I have heard it's a great course, and many other family members have found it very helpful. NEABPD, which I mentioned earlier, sponsors Family Connections. The authors for Family Connections, Dr. Alan Fruzetti and Dr. Perry Hoffman, who are specialists in BPD, based their course on Family to Family's 12-week model, but then added skills learning, and geared it specifically for family members who have had a loved one with BPD. Both Family to Family and Family Connections are led by trained family members. Both are free. I'm not sure about the NAMI course, but I know we at Family Connections do ask for a small donation to NEABPD if participants are able to give. Occasionally, professionals are also trained to be leaders of Family Connections, but they must have a co-leader who is a family member, and the professional cannot charge for their participation. Your loved one does not have to have a formal diagnosis of BPD for you to enroll into Family Connections. If your loved one is highly sensitive, highly reactive, and takes longer than others to calm down, then our information will help you. As I mentioned, Family Connections is a 12-week course. The information in each class builds upon the information from the week before, so we try to take people who can only commit to not missing more than 2 classes. It's taught in 2 ways, in person or by conference calling. Now with improved technology, some leaders like this format have moved to a web-based format. We try to limit our class to 10 or 12 participants so we have the ability to share and interact. Each group becomes very close because this is where, often for the first time, family members can open up about the challenges they face and no one judges them. The first few classes are about getting to know each other and learning about BPD. This helps to foster compassion for ourselves, each other, and our loved ones with BPD. We move into the importance of taking care of ourselves and learning techniques to calm down when faced with adversity. These include losing judgment, mindfulness, radical acceptance, and learning about healthier family dynamics and better communication. Validation is a core communication skill that we emphasize. Validation doesn't solve problems, but it can help bring the emotions down in our loved one when they are upset. When we can validate and our loved ones feel heard, the emotional part of the brain will often calm down and the rational part of the brain will come back into focus. In the course, we then move into problem management skills. Most of the skills, again, fall into good communication skills. When to talk about issues, how to discuss them effectively, and how to find solutions that work for everyone if possible. An example of a problem management skill is learning to wait until our family member is in a calm place to bring up something that needs to change instead of saying it in the middle of a fight. It's also learning how to say things in a non-judgmental way. For example, if you want to address the problem of your loved one's verbal escalation, instead of saying, I can't stand it when you were screaming and so foul-mouthed and I can't take it anymore. Don't talk to me like that or I'm out of here. You could try to talk to your loved one when they are calm and say, you know, I know when you're upset you raise your voice and swear, but I can't concentrate when your voice is loud and you say words that I find offensive. I really want to listen, but I can't focus when that happens. So I'd like to propose that the next time you start to get heated, I'm going to give you a warning. If you don't stop, I'm going to have to hang up or walk away. But after you're calmer, I'd be happy to have you call me back or have me come back into the room. Now, I can imagine the eye rolls out there at this point. I rolled mine the first time I heard a professional suggesting a discussion like that, when my loved one was barely even talking to me. But by the time you get to the problem management part of Family Connections course, hopefully you're already using some of the skills we teach and having better interactions, or at least feeling a little more confident. You also don't have to speak so formally either. In fact, we encourage you to use your own words, but just try to stay calm and lose any judgment when having these discussions. So basically, the progression of Family Connections like this. With education comes compassion. With compassion, we learn to stay calm and be non-judgmental. When we are in that better frame of mind, we can have more options and communicate effectively. And when we communicate better, we're good role models, and hopefully we have better outcomes. The Family Connections classes are usually an hour and a half to 2 hours long. It is a big commitment. There are advantages to both types of formats. In the in-person group, you get to interact easily with the leaders, and you get to meet the other family members in person. But there may be a commute involved for you, and it can make for a long day, especially after work. If you participate over the phone, which we call the course teleconnection, you can do so from the comfort of your home or wherever you need to be, and we can reach many of you in remote areas. With teleconnections, though, it's easy to get distracted by doing something while you're in the listening mode. I suggest you not do laundry or the bills or whatever it is that you might try to do at the same time. This might take away from your ability to hear the information about skills that will definitely help. Even with the phone and web-based versions, you still get to ask questions and interact with the leaders and other participants. I like to make the analogy that Family Connections is like teaching someone to fish or giving them a fish. You can eat for a day or you can eat for the rest of your life. In Family Connections, we don't give advice about specific situations with your loved one. We teach you skills so that you can handle a variety of situations. I can tell you that taking care of yourself first helps to put you in a better place to help your loved one. Compassion will help you stay calm. Talking calmly without judgment will usually help your loved one listen. And thinking about BPD as a medical illness might help you want to take care of them without getting resentful. So now I'm going to try to address some of the common questions and situations. Previous listeners have complained about their loved one's inability to do small tasks, disruptions at family gatherings, lack of motivation, financial help, by verbal tirades, and challenges of self-harm and suicidality. People with BPD don't have the skills we think they do. They may look and act better in situations from home, but then they fall apart so easily at home. Many of us have come to see that they are barely holding it together in the outside world. So they do collapse when the smallest thing pushes them past their limit. We family members also are their safe havens, so we bear the brunt of their dysfunction. They may not know how to do something, say it in the right way, but are ashamed to admit it. This is where stepping in a supportive way can help initially. But again, the goal is to guide them towards independence. You calling the doctor in front of your husband shows him how to ask the questions the next time. You walking into a family party with your sister, staying by her side for a while may make her feel more comfortable so she doesn't ramp up and explode during the party. Compassion might help you find solutions like sitting with your son while he does his homework and maybe working alongside of him when he does his chores. At first only, hopefully he won't need the help for long. Your daughter might not be motivated because she's so overwhelmed and might need someone to help her break the task or goal into much smaller steps. Financial help is a big challenge. There is so much financial help we give our loved ones. Therapists, medications, food, insurance, even gym memberships. Cutting someone off is a personal choice, but again, we can help them if we can help them simply by having a better relationship with them. We might be able to help them find other ways of being supported financially. Government assistance, even finding volunteer work to gain experience so that they can find a job. Verbal and physical abuse is extremely difficult. Many of our family members have been so verbally lashed that they suffer from PTSD symptoms themselves. Family members often freeze up when their loved ones start to escalate. We've even had a couple of families that had loved ones go to jail for physical attacks. Here is where your own safety comes first. You definitely need to talk to a social worker, a therapist, a doctor, or the police if you feel you are in harm's way. But if your experience with your loved one is more in the realm of verbal lashings, when your loved one is escalated, proper and effective communication skills and setting limits will help you put that to a stop. Self-harm and suicide is some of the toughest situations. With self-harm, family members' reactions are more about their judgments and their own judgments and fears. We think and we can say, how can they do that to themselves? Or even, how can they do that to us? But their self-harm is about themselves, not us. Many of us have come to finally understand it is a way for our loved ones to deal with their pain until they learn some better skills. When we lose the judgment and find compassion, we can react supportively or at least neutrally. We can say things, you must have been in a dark place to cut the other night. That must have been really tough. Versus, I can't believe you did that again. I thought you were over it. I don't want to go into suicidality much here, or at least I didn't think I wanted to in this presentation, because dealing with a suicidal loved one is really a situation where you do need some professional guidance. But please know you are not alone in dealing with this difficult challenge, and I'll talk about that more after so I don't get sidetracked. I'm going to try to wrap it all up. So in my own life, my family member has hated me passionately at times. I was blamed for everything wrong. Other times I was loved deeply by them and I was their best friend. I felt like a yo-yo and I became overwhelmed. I did all of the things I've already discussed. I changed my attitude, I got help and support, I became educated and found acceptance and compassion. I lowered my expectations, I learned to validate, and I also learned to manage our challenges more effectively. I learned to pull back and I tried not to give advice or solve their problems. It took a long time and it was a lot of hard work. I'm far from perfect, but I do try to keep doing better. I had to sit back and watch my loved one ride the BPD roller coaster until they were ready to get off. It was painful for them and for me, but I couldn't make them get off. They made mistakes and tough decisions. They had to want to accept that they needed help and made some changes themselves. What I did learn was to be patient. I planted little seeds when I was able, but only when they were calm. I mentioned books or techniques I had heard about, but I tried to do it in a non-judgmental way. I didn't say, you should do this, or you need to do this. I simply might have said, hey, I saw this article about such and such, and let me know if you want to read it. They might still have scoffed or rolled their eyes, but since I wasn't forceful or negative anymore, they stopped getting upset. By making changes in myself, I was ready to be supportive when they needed to make changes. And thankfully, they got the help that they needed. So I'm happy to say we actually get along great most of the time. No relationship is perfect. So many family members I have interacted with have improved their relationships too. But Family Connections isn't a be-all to end-all. After completing the course, we encourage people to keep reading, to attend lectures, watch videos, to listen in on these webinars, and keep up with support groups. Often they get close to other participants in the course and may find a supportive new friend. My co-leader and I keep in email contact with anyone who needs additional support, and we have amassed a wealth of resources and referrals. And if we can't help them, we can find someone who can. I actually even found some people on Facebook that have BPD and make their posts public. I find that following their posts have helped me see their side of things, how dealing with situations and others can be overwhelming for them too, not just my loved ones. Reading the posts helped me to keep compassionate. I also found a woman who overcame most of her symptoms of BPD and became a social worker. She sends out daily DBT email reminders to people with BPD who sign up for them. And she also sends a weekly e-newsletter to family members, full of helpful tips, poignant stories about other families. She also adds links to helpful articles. I signed up for the newsletter, and I find it a healthy reminder of the skills I have learned. And to be perfectly honest, I actually teach Family Connections so that I can keep my own skills sharp. I still make mistakes with my loved one when I'm tired and hungry and not feeling well, or overwhelmed with other things that are happening in my life. But overall, my new skills help every relationship with my life, not just the one with my loved one with BPD. My marriage is healthier, I've grown closer to my other child as well, and I'm a better listener to family and friends. And I even don't get upset in traffic anymore. I know most of you are in tough situations. I don't expect this presentation to be life-changing for you, But I hope, if possible, you don't give up trying to improve your relationship with your loved one. I hope you try to find something that works for you and your loved one get into a better place. Thanks for listening.
Thank you so much, Doreen. That was a really wonderful presentation. We have several questions that have been coming in as you've been speaking, but as you know, several people submitted questions before the webinar even took place, and so we have many of those in queue. So we'll try to get through those right now. The first one reads, does the match-up of gender affect the results of therapy for BPD? Should a male patient have a male therapist? How do you?
I think it's a challenge. I think sometimes that is what can happen, but I know with my own loved one, they were with the same gender for a long time, and some of them were good. They've moved around, so they've been with different therapists. But then they changed the gender this time, and actually it's one of the best therapists they've ever had. I think ultimately, like I mentioned in the information that I shared, it's really finding someone that they're comfortable with. And so, sometimes there's been trauma related, so if it happened with the opposite gender, then that may not be a good match. It may be triggering. But I think really, ultimately, no, I do not think that the gender needs to match. I think it's really finding someone that your loved one works best with.
Great. I just want to interject because I've seen several people ask questions about, can you list that newsletter, or can you tell us about that book, or whatever. And so I just want to remind people that you've generously agreed to send us links.
I'm going to send you all the links right to Amazon. And
so all of you who are live on this webinar right now will receive those links, and hopefully for those who are watching this in the recorded version, we will either have it on our website or we'll somehow embed the link in the recorded version. But if you are watching it on the archived version and you don't see it, please come to the McLean Hospital BPD Education Initiative website, and we will have the link posted there.
I think the challenges during this is trying to get all the information. So if I could talk about the books and the resources forever, so I just wanted to do it in the links instead.
Yeah, no, thank you. So question number 2, what can we do as a parent of a child with BPD to help them recognize their emotional triggers and learn to self-regulate?
I think this is a tough one because this is why I talked about that the changes can only happen in ourselves. I think that, that term, you can bring a horse to water, but you can't make them drink. I think that we can't make them recognize it. All we can do is, and this is where my co-leader came up with the term planting seeds. Sometimes you can just simply say in a non-judgmental way, geez, I see when this happens, this, you feel this way, or this sometimes make you act in a certain way. What do you think about that? Versus like, hey, every time you go to the family party, you cause a scene. Like, why are you doing that? So I think it's really about losing your judgment and staying calm and, pointing something out in a non-judgmental way. But it really sometimes, sadly, they have to kind of hit bottom or see a pattern in their life. My co-leader's loved one, years of bad relationships and cycling through jobs, et cetera, but it was finally when, someone else pointed out to her instead of the parent or the family member that, hey, maybe the common theme here is you, that they finally decided to get help. So this is one that's really tough. I don't think all you can do is be supportive and take care of yourself. And if you can plant something in a non-judgmental way, they hopefully will come to that realization. But I don't know what you think.
No, I think that's right. And I think your stressing of the word non-judgmental is so important because, as you've alluded to, the sensitivity to rejection or the sensitivity to perceived kind of I'm the bad person, and sometimes it's so extreme that if you point out something like, hey honey, did you do that technique, or did you try this, or what about that, they really hear it as you think I'm stupid, or you think I'm not trying, or you think I'm worthless, and maybe I should just kill myself if I can't stand it. I thought you were the only person on my side, and now you hate me too. And it really does turn into you hate me almost.
Every time. and I think that's the most challenging, is when you sit there and you love this person so much, and they're saying all these horrible things about you, or that you hate them, and it's just really hard. And I think that's when I say about getting not judgmental and staying calm, because if you say, of course I don't hate you, or don't say those things, I think what happens is that you're telling them how to feel. And so instead I learned to say, like, that must be really tough for you to think that I hate you. That's not true, but that must, what can I do to help you feel better? And I think when you say it like that, it totally changes the way that the conversation can happen.
Yeah, great. So question number 3, could you address the issue of strategies to protect younger children? That is, to psychologically help them to be resilient to the confusion shown in family relationships by an older BPD family member. Could you address specifically a situation where a preteen starts to verbalize something's wrong with a parent they had previously trusted in that question?
That's really tough, and that definitely helped. And it doesn't even have to be a younger child. It could just be another, a sibling similar in age or even older. And I think what happens is I was trying to protect my other child, and that ended up backfiring, because I think, again, it wasn't validating to the siblings' feelings. We would say, oh, everything's okay, or they didn't really mean to say that they were going to kill themselves or whatever, and they end up knowing it. So I think that to help them be resilient, I think to validate your other child's feelings, and also to really educate them. Our kids know what are going on, and they are more capable of handling the information. So what I started to do when I started to learn about BPD was I started to educate my other family members, and say, this isn't about you. This is something going on in their brain. All the things that I've already talked about, and that's how I handled it. I also got my other child into therapy too, so that for the same reason I found a neutral place, it gave them a neutral place. And our kids can't always articulate what they're feeling, and so when they started talking to their own therapist, the therapist was able to say to me, hey, listen, they're feeling left out, they're feeling like you're not being hard enough on the loved one, or whatever it may be. I think the other thing, that the second half of this question, is that when something's wrong with the parent they had previously trusted. My husband and I have been through the seesaw of who my loved one preferred or hated at the time, and it's really tough. I think what happens, again, getting back to not trying to correct them, your loved one could probably pass a lie detector and say that this person did all these horrible things when they didn't, because that's the way that they feel. And so what we started to address by learning all these techniques is to look past what they were saying versus what they were feeling. And so when they would say, I hate Dad because they did this, this, and this, and I even, my own family member wanted to legally disown, my husband at one time, when always my husband was the one that they felt more comfortable with. So it's just really, I think, again, looking past what they're saying to what the emotions are.
Great. Question number 4. What are some strategies for getting our loved ones to attend group therapy, DBT therapy, other resources that could teach them much needed skills to cope with life? My son knows something's not right, but doesn't want to do any of these therapies. The only one he goes to is individual and family therapy, and we're not making much progress. And this, I just want to point out, this is a question that often comes up in almost all of our webinars. How do we deal with or help a loved one who refuses to get help or refuses to acknowledge the diagnosis? They know something's wrong, but
it's been there, done that. I think it's really hard to answer some of these questions, I think, for everyone, because you don't know the particular situation, and really because it's hard to, you almost can't answer them. I think it always goes back to the things that I always talked about. What happens is you really can't force them. When I talked about us taking DBT, I felt forced to take it. So even I was sitting there like, listening and thinking, oh, it's just about them. And so what happens with our loved ones is that, they may not, especially if they don't see, although this one says my son knows something's not right. So again, in a non-judgmental way, if instead of saying like, well, if you'd only go to DBT, or if you'd only do this, things would be better. You could say, I really commend you. Going to therapy is really hard. And, maybe if we tried something different, we don't have to commit to it, but maybe if we talk to someone or try something different, all we can do is see if it helps. If it doesn't, then we'll go back. And I think what happens is, and I have a friend who was diagnosed with both bipolar, but actually I think she really had BPD. She was really helpful to me to look at things from their perspective. And what she told me was that it's really hard to start with someone new. You have to tell them all your deepest, darkest secrets. So maybe the fear of going to someone new, it's not necessarily the type of therapy, et cetera, but just the overall fear. And again, if we can validate, say, I know it's going to be tough to try something, but I'm here with you and I'm going to support you and do whatever we can. So I think that it's really waiting until they're ready for it. Again, planting those little seeds. I said the same to my own loved one many, many times. If you just did a GBT skill or something like that, but that's how I said it, if you would just. And so I think it's, again, trying to be non-judgmental.
Great. I want to take, I know we have some more in queue, but I want to take some from our live viewers right now. One person says, my wife has untreated BPD. I like your suggestion, don't take things personally. In general, I find that helpful, but when all of the outbursts are directed at me, blaming, criticizing, verbally, or even emotional assault, I find it almost impossible to remain objective. What tools or strategies have you used that are helpful?
It's really, first of all, I was a complete failure at it for quite a while. I definitely, I felt so hurt by the things that were said. So I can totally relate, and I'm so sorry for everything that you're going through. I think that really it was about, I found that I wasn't taking care of myself. So I can't stress all of the things that I've already said. I think the first thing is to try to find something for you to strengthen yourself. Because I think what happened was my therapist first told me, you shouldn't be saying this. You need to say, I am a good enough mother. I have tried the best that I can. And that was really hard for me at first because it kind of go against what we're saying, to be non-judgmental. But I think it was that when they first, when you first stand up to them, but again, I said it in a non-judgmental way, like, I know you're having a really tough time right now, but I'm trying to be here for you. And I think when you treat me this way, I can't do it. And so, but you don't want to say that in the moment. I think sometimes in the moment, I would just have to let my loved one go off to a point. And but then when I waited until they were calm, I think that, again, we've seen a lot of spouses and family connections, and this one's really tough because I think that, like you said, the hate and the love is so intertwined. And that when you start to stand up for them, they start to really think, oh my God, you hate me, etc. So I think first of all, if you can, get some help yourself, because I think for you to be able to talk and vent to someone else may really help. I don't know if that really helps, but I think it's really a tough situation.
Yeah, no, I think you're spot on. There's not an easy answer, unfortunately, and we all wish there was. And we all wish we could give like a recipe for here are the 5 steps to take to not take things personally. But you're right, and so many of their symptoms are related to interpersonal relationships. And we, the other people, family members, even treaters, have our own feelings and even have our own thoughts or needs. And certainly as family members, you have your own needs of what you expect and want from a relationship. And somebody living in the house and picking up after themselves or helping out or paying bills, and that's where it gets so complicated and difficult.
I think one thing too, my family member, and I felt so stiff reading, and again, I'm so sorry about it, but we actually use a lot of sense of humor with each other, and I think sometimes I would start to really think to keep myself calm, like, oh, that was a pretty good term that they just used, or, kudos to them, 9.9 on that one or something, in my own head, of course not out loud. But sometimes I think, we learn about mindfulness, and mindfulness is about being in the moment without judgment, and that's really hard to do. So sometimes what I really had to learn, and it was really hard for me, I would, grip my chair, and I'd really go to a different place when they were going off and saying, okay, this isn't about me personally. Their voices raised. When you look at literally basic descriptions, their voices raised, their brow is borrowed, brow is borrowed, or whatever it is, if you can look at it descriptively versus, listening to the actual words that they're saying, a lot of times that helps too.
Great. And so I think we're going to have time for just one more question. It's probably a complicated one. A couple of people have asked about it even today, and many people have asked about it in the past, and I'm really interested in your perspective. So it's a common dilemma, though. So what about an adult child with BPD, but we'll even broaden it a little bit to older teenage child with BPD? How do you think about distinguishing the difference between kind of being supportive and making accommodations and lowering expectations versus enabling versus allowing bad behavior or irresponsible behavior, the concept of tough love versus validating and just rolling with it kind of comes up. But I think a lot of parents in particular really struggle with that.
Absolutely.
And any thoughts?
I think, again, this is really hard and something I eventually needed professional help with. I think in the beginning, you just want your loved one better. So you want your home life to be easier. So that's where I think it's a slow downward slide. You start bringing them their meals instead of making them come to the table. You start doing their laundry instead of them doing it. You clean up their room, or whatever these things may happen. And it doesn't happen all together. It happens in these little steps. And then the next thing you know, you're a slave to your loved one. And it's really hard to get out of that. What I do, but this is where the medical mentality or the medical perspective helped it. I had a friend with someone with Down syndrome. I had another friend that her daughter had a severe stroke, horrible situation after after she delivered a child, and they became again in a caretaking position. And what I found was that they rejoiced in every little thing, even though a lot of things were really tough. And so what I started to do was to really try to find that balance, to say, I'm going to cook dinner, but if you want it, you need to come down. And if you need me to do this, just ask me in a nice way and we'll do it, but I'll do it this once, but I'm not going to continue to do it. It's really, really hard to find that balance. And I finally did have to call someone at one point because I would get better at it for a while and then slip back. And I remember calling a therapist who I'd heard about and said, I've crossed the line into enabling. And so I think it's something sometimes you really need someone with professional help with, because if you've been doing these things for your loved one for a long time and then you stop, it can really release a really tough situation. So I think that what you have to kind of keep your eye on the goal is that, is this thing that I'm going to do for them really helping them? And I think that, the financial help or physical help, and to try to say, would I do this for someone else? And this is where that whole thinking about a coworker, if my loved one asks for a ride and it's raining out, you'd probably do that for anyone. But if they want to ride every day, then that's going to be, an issue. And it's trying to talk about it, again, in a non-judgmental way or in a calm situation versus at the moment. And so it's really hard to do.
No, I think that's helpful. And again, no clear, easy answers and no recipe for how to deal with every situation. And so with that, we are out of time. And this has been a really wonderful and valuable presentation, Doreen. So thank you so much for sharing your experience and your wisdom. We hope people will sign up for our next webinar. The next one will be done in Spanish. So for those of you attending this one, you're probably speaking English and don't need that, but we are trying to reach out to broader audiences around the world. We hope you have enjoyed this webinar, and we will say goodbye.
I want to just say that I have been available to other people on the phone that sign up for connections, family connections and everything. So if anyone has something, I'd rather speak, more intimately on the phone with someone. So certainly, if you'd like to speak with me, I'd be happy to do so.
That's very generous of you. I hope you're not overwhelmed with
No, I know.
thousands of
it for others.
We may ask you to come back because this was a really phenomenal